Reason for the sneeze, and we know that Kentuckiana is legendary for its pollen count. But allergist Dr. Thomas Higgins is here to put some numbers to it. We've heard, number one for fall allergies a couple of years ago, number 4 last year, which sounds like incremental improvement, but not fundamental improvement. You can talk about some fundamental improvement, right?
Yeah.
How do we do this? And we have a patient who I believe can probably explain what this fundamental improvement is. What are we talking about?
Well, allergies obviously are difficult in Louisville, and you can have allergies that can worsen what's called chronic sinusitis, which can be an infection or an inflammation of the sinuses or lining around the nose. And some people with this condition require surgery. And so one of the things to do with when you're managing somebody with chronic sinusitis is to make sure that they do not have any scar tissue or that they heal properly. April, I saw a year ago, and she had terrible symptoms of sinusitis, and she had surgery before, and so my goal for her was to open up her sinuses and keep them open, and so that she would have long-term relief.
Did he have to do, April, a fair amount of convincing for you because you'd had not necessarily the greatest experience in dealing with this in the past, or was this something where you've been dealing with it for so long, hey, any boat in a storm, get me fixed?
Yes, I went to several doctors before, and they said, you've already had a previous sinus surgery, and there's nothing else we can do for you. We'll just get scar tissue, you'll just be worse than what you are. And I went to him, and he's like, I can help you. And I'm like, whatever you have to do, I'm on board. That's great. And, I have not taken a single allergy pill since my surgery, which is amazing. I used to go through a box of Kleenexes a day sometimes, and it's been awesome. I can breathe.
How long were you down for the surgery, and how long was the recoup time?
Actually, when I came out of surgery, the first thing I said was, I can breathe. And I mean, really, I didn't even take pain medicine.
That's terrific.
Yeah, it was awesome. It was like a few days. It wasn't bad at all.
Doctor, is this something that you do as outpatient surgery? You're in the office in the morning, you're out by the afternoon, or is this something where I'm going to have a hospital stay overnight?
No, it's an outpatient surgery. You get to go home that day, and the recovery is really good. As she said, usually there's not a lot of pain involved, and people feel relief pretty much right away.
You're going to have a number of people who hear this and say, oh, I deal with sinusitis. Am I the ideal candidate for this? Is there one particular candidate, such as April, who is better for this than others, or is this something that can really be used for anybody who suffers from this on a continuing basis?
Well, this isn't for everyone. This is for people who have sinusitis that doesn't get better with medicines, or they have recurrent sinusitis, so they have sinus infections over and over and over, and we need to do something in addition to medicines to help them.
Has insurance caught up with the medicine? Are most of these procedures covered by insurance, or are you finding out that you're on your own?
Most of them are covered by insurance.
Fairly easy to get your insurance to cover? Do you have to give them a heads up on this? Were they fairly familiar with it, or were they on board almost immediately?
They were on board.
And my office staff does a great job of doing what's called a pre-approval to talk to the insurance company about if they will be approved for the surgery before we do it.
Do they contact you by phone, or do they contact you online?
Both.
Give us the phone number, give us the web address for us.
Okay. Our phone number at our office is 502-894-8441. You can see me online at www.higgins-sinus.com. Very
good. Thank you so much for joining us this morning. It's great to know that you're breathing a little bit easier. It's got to be just a tremendous, almost fundamental change for you. Now let's see if the weather will cooperate with us and ease some of those sneezes of the season. How about?